Today, the Biden administration laid out new COVID-19 mandates that could impact thousands of Montana employers and their employees. All federal employees, federal contractors, and healthcare workers at facilities receiving Medicare or Medicaid have until January 4th to be fully vaccinated. People who work at businesses with more than 100 employees must also meet that deadline or test weekly and wear a mask at work. Now, businesses could face fines of nearly $14,000 per employee per violation. And federal workers and contractors who don't get the shot will face disciplinary action, which could eventually result in them losing their jobs. Well, swift and certain reaction from Montana Attorney General Austin Knudsen today. The Montana AG announced an imminent lawsuit against the Biden administration. Knudsen says the non-medical portion would apply to more than 142,000 Montana workers, more than a third of the private sector workforce. Governor Greg Gianforte siding with Knudsen, saying the vaccine mandate is unlawful. Wyoming Governor Mark Gordon also plans to file a lawsuit tomorrow. Now, here in Montana, the battle has even more levels to conquer. Montana's House Bill 702 says a vaccine mandate is illegal discrimination. The Yellowstone County Health Department is torn like other medical and non-medical employers. It has 30 days to come up with procedures to implement the new federal rules. But the county health department follows state law.
The choice that's being put in front of organizations today as these rules roll out is, do we choose to violate the state law and actively discriminate? And that's a hard thing to say, like, that we will choose to violate state law. Or do we choose to violate the federal rules, which in the case of Riverstone Health, as an example, would be about close to half of our annual revenue if we lose federal funding through this. So which of those choices do you take?
Felton says this will obviously play out in the courts, and when it comes down to it, Riverstone Health, St. Vincent, and Billings Clinic will have little to do with the final decision.